Hi everyone, my name is Elsie. I'm the host of Birthing at Home, a podcast, but I'm also the mum to two boys, both born at home. I'm a home birth advocate for the state of Victoria in Australia and broadly, and I'm a nurse. So today I thought I'd do some little videos trying to help demystify home birth. This is not education for why you should choose a home birth. There's a lot of other great people and resources that can do that, like Rachel Reed and Sarah Wickham and stuff. The Great Birth Rebellion, the Midwife's Cauldron, just to name like a couple. This video or this series of videos is for women that already think they want to have a home birth, but they're not really sure how to like make it happen. Which is something I commonly see on Facebook groups, especially, or Instagrams, like, I want a home birth, but like, how do you actually do it? So actually in the state of Victoria in Australia, we're about to have the most publicly funded home birth programs in Australia. So we're going to have about 5. So there has for a while been Sunshine Joan Kerner Women's and Children's Hospital in the western suburbs. That hospital's been offering publicly funded home birth for a little while now. Geelong Barwon Health just started their publicly funded home birth program in January 2024, and the Royal Women's also started offering publicly funded home birth in January 2024, and then hopefully sometime this year Heidelberg Mercy Women's will start offering it, and Berwick Monash Hospital will start offering it again. Theirs closed down during COVID for some reason, but soon there's going to be 5. That's pretty lucky. No other state has 5. Some states don't even have any. So with the increased accessibility to home birth, I started to worry that maybe women would try and go down this route and be told that they don't meet the criteria for these home birth programs, these free, and then they would discount home birth altogether, which is not the case. So I'm here to tell you how to make a home birth happen, whether you're going through the publicly funded home birth model or through the private midwifery model. If you don't fit either of those categories, I'm totally for free birth. But because I personally have not had free births, I don't feel like I can really comment too much on it. I just think they're amazing. You can listen to them on my podcast. I definitely tell the stories. But there's other resources that you can look into if you want a free birth. So the first step is that you think you want a home birth, but you're not sure. Okay, so step 1, do you live near a hospital that offers publicly funded home birth? That goes for anywhere in Australia. And one of the criteria is going to be, do you live within a 30-minute radius of the hospital during peak hour on a weekday? Yes or no? If you don't, which I don't, then you can't have a publicly funded home birth. So you can't have a free home birth, which means you would have to go and hire a private midwife. So some midwives, including hospital midwives, they can be the second midwife, not the primary midwife. So to be a primary midwife, which means that's the midwife that is like charged with your care, basically, they have to go through separate or like additional training through an endorsement to be able to provide private midwifery care, also in the context of the actual birth component. So you need to find a home birth midwife, essentially. If you do live within the 30 minutes of a hospital that offers publicly funded home birth, then you basically just attend the hospital as you would. Different hospitals have different criteria on how to actually access their home birth service, but I can go through that in another video because there's like 5 of them. So to find a private midwife, you can in Victoria, You can either search on the Homebirth Victoria Facebook group. I set that up after I had my second home birth last year because I didn't actually realize that there wasn't a community in Victoria, and now there's over 300 members, so definitely join that. I've created some resources that are available in the Google Drive that can help guide you, and basically it's like the text form of what I'm talking about here. And you can also ask for, I guess, recommendations and whatever. You can also find a list, obviously, of private midwives that support home birth in Victoria. Otherwise, you can go onto the Homebirth Australia group. There's a Facebook group, and then there's also a organization called Homebirth Australia, and they've been around for 36 years this year, I think, because they're having their 36th annual home birth conference on the Sunshine Coast at the end of the year, so that's pretty cool. But there's also a bigger, I think there's like 10,000 or 14,000 members in it, Home Birth Group Australia. So it's Home Birth Australia as like the website, and Home Birth Group Australia. They're not related, but they both are for home birth. And you can find private midwives like that, so that's good if you're not in Victoria. If you're in Victoria, I really encourage you to join the Home Birth Victoria Facebook group, which hopefully will be a website one day. So you need to then reach out to a midwife, basically. So it's just like as you would hire a GP. Like if you'll go to a GP and you didn't like them, then you wouldn't go back, presumably. So contact midwife. You need to be asking them questions as well. Not all midwives are the same. There are some differences between private midwives in like where they work or how they work. So some midwives practice by themselves, and they have like friends that are midwives or something that they can reach out to for the second, because it's the law to have 2 midwives. Of course, sometimes it doesn't happen that way. The baby will come when the baby comes, whether the second midwife or the first midwife is there. But by law, you're meant to plan at least to have 2 midwives there, make a reasonable effort. Some midwives work kind of like in a collective, and so they all support each other. And then some midwives work for a business or like a clinic, and that is more like a roster kind of setup. Like they are paid to be there on certain days, and on certain days they have days off. And there's a fourth variation, there might be more. There's a fourth variation where some midwife clinics or groups have admitting rights in hospitals, which means that they are guided and influenced by hospital policy, which can have risk factors as well. But you need to figure out what you're most comfortable with, basically, which of those four options are available in your area. Because a lot of midwives will, have a basic radius of where they work. So you need to figure out and contact them. So I'm just looking at the resource that I created on Homebirth Victoria's Facebook group, so you can access this through the file section. It's the Google Drive. I'm going to update it hopefully every month, but anytime there's a change. So you can see planning a home birth in Victoria. You can see like the rough costs, so private midwifery clinic, private midwifery group practice. It also tells you like some pros and cons. Of course, it's not like a comprehensive list. So step 1, consider the features of the options and what is available to you. If you can't access publicly funded home birth, put it out of your mind. You can't access it. The hospital is not going to change the rules for you. Step 2, contact and chat to the possible midwives ASAP. So I say ASAP because depending on like time of year, who the midwife is, and what's going on in the midwifery home birth world, home birth midwives book out very quickly. A lot of home birth midwives take a very small amount of women per month That's like when your estimated due date is. So if there's like 4, 5, 6 women due in April, they might not take any more women on. So you need to be looking into it ASAP, like ideally before 12 weeks, which can be hard because a lot of women only find home birth like later on in their pregnancy. It's definitely not impossible to switch to a private midwife later in your pregnancy. It's just trickier. And especially if you live in an area where private midwives are not super accessible, it can be even harder. I'm going to do like another video on suggestions on what to ask your private midwife, whether that's in a midwifery group practice, hospital setting, through publicly funded home birth, if it's through a midwifery clinic group, or if it's a more independent private midwife. These are going to be some questions you can ask. I'm going to put that in the next video.